Okay, so I'm here for my skin fold assessment. I have my husband Caleb with me, and we're going to be taking some skin fold measurements with him. So first, I'll just explain the procedure. Hi, Caleb. My name's Allie. I'm a student physical therapist.
Nice to meet you.
We're going to do some skin fold assessment with you today. Are you familiar with skin fold tests?
Yes.
Okay. And what do you know about skin fold tests?
Body fat composition.
Okay, yes. So it's we use these measurements and we put them into an equation, and then it gives us a rough estimate or a pretty good idea of what your body fat composition looks like. So we don't have calipers today. We would be using calipers if we were in the lab. The skin fold, I'm going to give your skin a little pinch just like this, and then if I had calipers, I would take them on the other side and measure. So if you don't mind, I'll show you that on your arm. Are you okay with that?
Yeah, that's fine.
Okay, so again, it's just a small pinch kind of like this, and then I would take my calipers and measure just outside that.
Okay.
Okay, so that's what we'll be doing. We have a few different sites that we'll be doing that on today. Do you have any questions about what this will look like?
No. Or
the assessment itself? Okay. So to take some of these measurements, or most of them, a lot of them are up in your chest region and kind of into your abdomen. So it's going to be best if you have your shirt off today. Is that okay with you?
Yeah.
Okay, awesome. So you can go ahead and remove your shirt. I'm going to measure, make sure that we have all of our sites marked out so that when I go to take the measurements, I'm accurate in where I'm choosing to take those from. So I'm going to go about 2 centimeters or an inch to the right from your belly button here, and we've got a mark there. That is for our measurement of the abdomen. And then we've got the measurement of the chest here. We're going anterior mid-axillary line to just about the nipple, and it's a diagonal fold here. So about halfway through there, we'll make our mark here. And then we're staying on this mid-axillary line, and we're going just above the ASIS here. And it's, again, a diagonal fold down here. So we'll just palpate there, make sure we're on this line. And that is going to be our skin fold there. I'll have you turn around for me. And we're going to go from the acromion here to the olecranon process. Got about 39, and we'll go halfway, so just about right here. That's going to be our tricep fold for the back of the arm if you want to turn to the front. I'm going to have you scoot back just a little bit so that we can see. Good.
I'll just hold that.
Okay. So we're going to go just about from your hip crease down to the patella here. So I'll have you hold that there for me. Thank you. And we'll go about halfway. Do you mind lifting your shorts? Sorry.
No, you're good.
We'll put that back up there. Good. And again, about 22. So right in here is our mark. Okay. Thank you. And then we've got one more location on the back, if you want to turn. This is a subscapular, so kind of drawn out the border of the scapula here, and then we're just going right underneath that. This is, again, a diagonal skin fold here. Okay. So we're going to go through each of the locations. I'll take a few measurements at each location, and then, so I'll take one measurement at each location, and I'll come back through them kind of cyclically, so we don't hit the same location all too soon. So we'll just start here at the chest region. So I'm going to make my pinch not quite at the location that I want to measure, so I'm going to make my pinch just a little bit higher, and then I would take my calipers and measure. I want to do it quickly so that the skin doesn't have time to adapt. We'll move down here. So again, I want to make my fold, take my measurement, and remove my fingers here. We've got a vertical fold. So again, are you relaxed?
Yeah.
Okay. making my fold here, taking my measurement, and then coming off. We'll go down to the thigh here. So I'm going to just have you
relax.
Yep.
Okay.
Kick that leg out in front. Just relax it for me. Good. Okay, I'm going to make my fold here, take my measurement. Oh, you can't see. Sorry, will you scoot back? Okay, so again, going to have him relax his front leg, take my fold here, measurement there, and then move on. I'll have you turn around. We'll do triceps first. So again, finding my location here, I'm going to go just a little bit above that, take my fold, and then come off. And then, if you want to turn just a little bit more, here, take my skin fold, measurement, and then come off. So we'll turn back to the front. I would go through the same order second time around. So again, taking my fold here above my mark, and then measuring, coming off. We went down here next. So again, this is a diagonal fold. Here, measure, come off. We went to the abdomen next. So again, here, measure, come off. We'll scoot back a little bit so we can see the thigh. You want to relax your leg again. Good. Gonna fold there, measurement, and then come off. Scoot forward, turn. We started with the tricep, so we'll take my fold here, measure, come off, and then lastly, subscapular, taking my fold, measurement, and then coming off of the area. Okay, and then we're going to take the measurements a third time. So again, starting here, same order. We can just turn a little bit. Sorry, so
Straight.
Yeah.
Okay.
See. So sorry. Thanks. Getting my skin fold here, measurement, come off. Getting my skin fold here, my measurement, and then I'm coming off. Here, I am getting my skin fold, measurement, and then coming off. We'll scoot back for the thigh. Will you pull your shorts up just a little bit for me? Thanks. And relax your front leg. Good. So my fold, my measurement here, and coming off. Scoot up and turn around back to the triceps. So got my mark here. Gonna take my fold right here, measure, and then come off. Right here, fold, measure, come off. Okay. And that is my skin fold assessment.